Medication stewardship is RevityRx's methodical framework. Our framework applies evidence-based methods to augment clinical decision-making, simplify operational workflows, and enhance stakeholder engagement, with the goal of superior therapeutic outcomes through pharmacological therapies.
The medication use process is a sum of activities that results in a patient receiving a medication to treat a health condition. It is the clinical and administrative process elements from the point of a doctor or an APC determining which medication to use, through the patient receiving therapy and being monitored for the therapy's progress, through the payment of service, whether that's fully funded by the patient or a portion is paid by a health plan or a plan sponsor. The overall process is complex, and it's touched by an array of different entities, and it is influenced by where the patient is seen and care is delivered, and also the acuity of the patient's condition. To demystify the complication, RevityRx uses a three-sided model focused on the functional nodes of the provider entity, the healthcare consumer, and the medication. The sides of the model link the nodes and represent the process activities. The provider entity encompasses the healthcare setting, the systems, tools, and personnel that touch the medication use process. From a macro level, this could be a multi-hospital integrated care network, a single hospital, a nursing facility, physician practice group, or a single provider's office. We can also look at this from a micro level, which is the clinical or administrative personnel involved with the medication use process, or a system enhancement tool. This node includes all components that touch the medication use process to deliver care that is highly reliable and safe. The patient is the key member of the healthcare consumer node. They take on a dual risk within the process for their health and also the financial stake. They are the ultimate reason for creating high reliability. Other members of this node are the health plans and the plan sponsors. While they do not take on the same level of dual risk of the patient, they do have a significant financial stake and influence over the process. The medication is the least dynamic node in the process. Since its physical properties are set and its uses are set based upon what conditions it can treat, it's mostly influenced by provider or consumer nodes deciding whether or not to include a specific medication within the process. RevityRx uses this medication use process model with the aim of enhancing our clients' clarity to the overall process to find and prioritize opportunities for optimization and improve high reliability.
Our philosophy and the goal of the medication stewardship framework is to create systemness between these three nodes by applying evidence-based methods and process improvements specifically focused at the healthcare consumer and provider entities. As these relationships begin to come together, we see high reliability medication use practices emerge, resulting in improved patient outcomes, physician and clinician satisfaction, and financial gains. Regardless of where each organization is on their journey to narrowing this gap, there will continually be opportunities to mature and further simplify the medication use process. For a deeper look into RevityRx's medication stewardship framework, check out our latest insights.